Dr. David Schwartzberg, and let's talk end ileostomies. Similar to a loop ileostomy, where this is one continuous piece of bowel that we can brook and then unbrook. And since it's all one piece of intestine, usually you can do it 3 months later. The difference is it usually takes around 6 months for an end ileostomy because there is no other piece of bowel that's readily available. So if that's an end ileostomy, well, where are you going to connect it to? A lot of times someone has a rectal stump, which is what we call it. So this is the ileostomy, and this has to be taken down, but then we have to go dissect the rectum as well. So this is now a lot of dissection and a lot of scar tissue that you have to cut away, and it's quote-unquote a real operation, where an end ileostomy differs from a loop ileostomy. A loop ileostomy is a very local operation. This may involve laparoscopic surgery or open surgery to connect the two ends. A lot of times this happens if, let's say, someone has ulcerative colitis. In an ulcerative colitis, we have to take the entire colon and the appendix. Your appendix comes out also in these situations. And what we do, especially if it's an emergency, is take out all the colon. We turn this ileum into an end ileostomy. And then we have the rectum that we leave in place for right now. The thing is, when you close the rectum, you can either use sutures or staples, but the point is if someone's malnourished, has been on steroids, it's an emergency case, you get worried that this staple line may break open. The tissue's too weak to hold the sutures. And if that's the situation, there can be a big abscess. So you can, in a good quality tissue, leave the staple line in place. But if it's bad quality tissue because of an emergency situation, you may have to take this rectum and bring it to the skin and essentially make it a stoma. We don't call it a stoma, though. We call it a mucus fistula. And the only difference between a mucus fistula and a stoma is that the mucus fistula is very low output because it's not having any stool contents. All that's going into the ileostomy bag. And the mucus fistula is really just a way for it to decompress all the bacteria and all the mucus that may collect here. Now, yes, some of it may go out of the person's anus and they may still have some bowel movements. But if you're worried about the staple line, you can bring it to the skin. And it's actually a very safe way of dealing with the other side of someone's bowel. But because to reverse this is an entire operation to then find the other part to reconnect it. And if you did reconnect this, that would be called an ileorectal anastomosis. And if you didn't, and you decided to take out the rectum, you can live with an end ileostomy, or we can then make this end ileostomy into the shape of a J, and we'll talk about that in future videos. Thank you.